Hi everyone, and welcome to the 5-minute video study for the NCE. Today we are under clinical focus, and we are going to be covering AK, terminal illness issues. So when we are talking about terminal illness, that is one of the most difficult areas for counselors. Terminal, or usually another word could be hospice setting, are individuals who are dying. The needs of the dying are very complex, and many times there is a multidisciplinary team. They could be mental health clinicians, it can be doctors, it could be nurses, so it could be a variety of different individuals who are attending of the individuals in hospice. Some of the needs are physical needs, and that's usually things like pain management, different medications, and that ties into psychological interventions such as biofeedback, hypnosis, relaxation, imaginary techniques, which kind of can play a role in that pain management for the patient. Also, other things could be the notion of looking at kind of the disillusion and kind of how that can match reality for many patients. The changes of the body, their strength, their fatigue, their appetite. So a lot of those physical changes can happen with terminally ill individuals. Also, emotional needs. Because of all the physical changes, now you have to cope with things like anger, fear, guilt, or grief, which kind of coincides with those stages of grief that Kubler-Ross talks about. Dying individuals can certainly benefit from counseling in order to look at some of those emotions and kind of see, how some of that grief can be managed as best as possible, and having the open communication, especially with family, in order to kind of support. Other areas of needs would be social needs, so the social involvement, and a lot of times friends and family, looking at those connections, the unfinished business. If they've kind of wish they would have said something to a loved one, or if they have had different issues throughout their life, and now they feel like they need to apologize. The other areas is spiritual needs, so kind of looking at their connection with a greater sense, right? And it may or may not include a religious denomination, but it's more of just finding meaning, and that's where that existential comes in, right? Finding meaning, finding both the kind of the good and the bad, and taking kind of what that has meant for them in the past, and then looking at what type of legacy, or what type of what type of memories they want to kind of emphasize. With terminally ill, there's also practical problems to consider. So their possessions, their finances, their trust. How do they want their funeral to be planned? Which family members do they want to take care of which things? And then with terminally ill, and it affects the whole family unit, right? So that's where you're looking at the family and kind of their own emotional needs, and how to best support them in a multi generational facet. So those are just some of the things to be to consider when you are working with the terminally ill or individuals in hospice.